Friends, today I'm going to talk about the details about ZSR circumcision surgery and the dressing schedule. So, I'm Dr. Sachin Kuber and I am the chief surgeon who is performing ZSR circumcision surgery in India since last 1 year, and we have enough experience now to tell you that how it is done, what should be done and what is not to be done. So very important things, please listen to this video carefully and you will have all the ideas. This is applicable for the patients who want to do ZSR circumcision, that is stitchless circumcision. Also this is helpful for the patients who have done ZSR circumcision surgery at our clinic in Pune city, Maharashtra, India. Let me tell you, our website is circumcision-clinic.in and we are exclusively doing circumcision surgery with the help of ZSR stapler in Pune city, India. This is in Maharashtra state. So you can visit us on Facebook as CS Clinic. You can visit us on Twitter. Also you can visit us on Instagram. Also we have YouTube channel, that is Circumcision Clinic. And you can have all the information about the types of circumcision that we do, also the difficult and different types of circumcisions that we can do. Now we can tell you that this ZSR circumcision is the most advanced circumcision in the world and this is done very quickly. So we are getting a lot of inquiries from the patients who want to do circumcision, who have the penis problems and they want the definite treatment but all the time afraid of the pain and the suffering after the surgery. So here the video will help you to get over your issues so that you can take the decision for doing the circumcision surgery. So the first question is it painful? So let me tell you again that in my previous videos I have mentioned that this circumcision is painless because there is a titanium blade inside the stapler which cuts very sharp and does not damage the nerve like a scissor do. So in traditional circumcision there is a scissor which is used and that scissor cuts abruptly the skin. That's why the patients get a lot of pain after the surgery. But with this ZSR stapler there is an inbuilt titanium blade that cuts the foreskin. That's why you don't get the pain at the time of surgery, also after the surgery. Of course, this surgery is done under local anesthesia to the penis with the help of injection of the painless needles. Now, after the surgery, there are enough amount of the painkillers or the medicines which reduces the pain are given properly in proper dose. These are mild and they don't provoke any pain. Because of the nature of the surgery, the titanium blade that cuts the foreskin, the pain factor is significantly reduced after the surgery. Almost all of our patients are telling us that they don't experience a severe pain. Only a minor discomfort which is manageable is felt by the patients. So really this is painless. So next question is, how much time this ZSR circumcision takes to do? Literally speaking, this ZSR circumcision is quickest in the world and after the installation of concave cup and stapler, it only takes 10 seconds. Yes, 10 seconds for circumcision to do, and this is the quickest and most reliable circumcision in the world, which is told by the company. So, and my experience also tells that really it is done in 10 seconds. The whole procedure lasts only about 10 minutes and after 10 minutes the patient is taken out of the operation theater and he is observed for only 90 minutes, after which the patients can go home. Even if they are coming from the far distant places, like many of our patients come from Delhi, Chennai, Malaysia, Thailand, America even. So those patients can immediately go to their destination city on the same day. Next question which I already get is it safe? So let me tell you that this is the safest method of circumcision, because see, other clamp based circumcisions which are available in the world are a lot time consuming. In today's world, patients don't have time. All people are busy. They don't want to spend some clamps which stay on the penis for 7 days, and after that 7 days it has to be removed, and the dead skin falls down in another 7 days. So around 21 days it takes for recovery. So with the help of ZSR, there is a deploying of silicone ring which contains the staples, and that silicone ring detaches itself in 7 to 15 days. So the complete recovery can be expected by the patient by the end of 7 to 15 days. So this is very quick circumcision, almost painless, and the patient has ability to move around. He can go to the work on the next working day. So this is very fast circumcision, and this does not give you any pain or discomfort. Next question is, how much bed rest is required? So the patients who undergo the ZSR circumcision in our clinic don't need rest. People are busy, patients are busy, they don't have time, and they have to do a lot of things. So typically this procedure is done on OPD basis, that is outpatient department basis, and this is done in 10 minutes, discharge in 90 minutes, so that the patient can go home, stay, and from next day or even from the same day the patients can start working. There is no bed rest required for this ZSR circumcision method. Next question that we always get is, what is the recovery period? For non-diabetic patients, we can tell that it can heal in 7 to 10 days. In 7 to 10 days, that silicone ring which is deployed for sealing of the cut wounds is falling down automatically. No need to remove. The patients don't need to come back for a follow-up, and the healing occurs almost in 15 days. The next question that we get is, how much vein or the nerve that you see on the skin of the penis, that is prepuce, will it be cut, will it be damaged? So the answer is no. The silicone's ring which seals the nerves and veins on the prepuce or foreskin, that it does not give any damage to the patient. So I was telling that this nerve and vein is not cut with the help of scissor. It is sharply cut and sealed by the titanium blade and silicone ring inside the ZSR stapler, so that the patients will not have any issue like the infection or like the thrombosis in the veins after the ZSR circumcision surgery. Many times we get this question again and again, that at what age ZSR circumcision should be done. So let me tell you that ZSR circumcision is available for all age groups, from newborn to the oldest person possible. So we have a different scale measurement guide, and according to the guide, particular device which fits the penis size of that patient, like a newborn we have number 10, for 3 months old baby we have number 12, like that it goes on increasing up to 34. And according to the girth or according to the size of the penis, that particular size device is selected, and that is used for ZSR circumcision. So I can easily tell you that this ZSR circumcision is safe and it is easily done in all age group patients without any complications. Next question is, are there any complications with this ZSR circumcision? The answer is no, because we choose very carefully the patients. If there is a diabetes for the patients, we control the blood sugar. If there is blood pressure for the patient, we control the blood sugar. If there is any infection in the skin of the penis, or it is called as in technical terms balanoposthitis, we control it with effective medicines, and after that we treat the person with the ZSR circumcision, so that the least possible complications or almost no complications occur because we do it perfectly well, and that's why the patients don't have any complications, or no patient has ever reported any complication yet. So the patients who are traveling from distant places from Pune can confidently come to our clinic and do ZSR circumcision. That will help them to build a confidence as well as a complication free circumcision. Next question: does the patient require to come back for a follow-up? The answer is no. We have designed this ZSR circumcision surgery in such a way that the patients who want to do ZSR circumcision are once and for all treated at the same time. Few antibiotics and painkillers are given at the time of discharge, and the patients go home safely without any complications of bleeding or any infections. Those patients can go home, and this is really a patient friendly procedure in which you don't have to come back for a follow-up. And the beauty of the new technology is we are continuously available on mobile phone, WhatsApp and email. So 24 hours support is given to the patient. Patient can always contact us at any time of the day or night, and they can have their question answered. Even after circumcision, ZSR circumcision, they have any questions or they have any difficulties, we can guide them at that point of time. So this is really a tension free, complication free ZSR circumcision, that the patients always feel that you are directly in contact with the doctor who has done circumcision, that is myself, Dr. Sachin Kuber. The next question that I always get is whether that ZSR silicone ring has to be removed or it falls down. The answer is that is automatically detachable. It can fall down automatically depending upon the patient to patient in maximum 7 to 15 days, and it does not need to be removed. Automatically, once it heals, the silicone ring that falls down automatically, or it is detached from the penis, which you can cut. Next question is the how dressing is done after the ZSR circumcision. The typical plan for our circumcision is the ZSR stapler is very useful in preventing the infections. So the patients are at peace of mind that infections will never occur, but still as an Indian territory, we are advising the patients to do dressing for 5 days. There are few materials which are prescribed, like some soaps, some ointments and the gauze and the stickings. First, after 24 hours, you have to remove the dressing carefully, and with the help of the soap which is provided, you can wash that area completely clean. That is antibiotic soap. And after that cleaning, make it pat dry, and after that drying, use the antibiotic ointment which is prescribed to you and wrap the gauze around the glans penis on the silicone ring. The glans penis should be exposed so that you can easily pass the urine. After consecutive 5 days of dressing, you can keep it open and repeat the procedure of washing with the soap every morning, and after making it dry, you can apply the ointment for next 5 days. Following this, after 5 days, the next level you have to do is the wash with the antibiotic soap, making it dry and applying the same antibiotic in the form of powder. That Neosporin or betadine powder is prescribed, and that powder you have to apply for next 5 days. Maximum 15 days schedule is given. Once you keep it open more and more, the silicone ring will detach very quickly in 7 to 15 days. So by the end of maximum 15 days, you will be free of that silicone ring and wound will be almost 99% healed. This is the schedule which has to be followed for every patient. So the next question is the sex after circumcision. This is very important questions. Also people ask me about masturbation. So these things are very important, and let me tell you that a 45 days period is kept for complete recovery after ZSR circumcision. So the patients who underwent ZSR circumcision or any other circumcision method should refrain from sex for at least 45 days because the internal healing is occurring in that period of time. So my request is wait 45 days for masturbation and sex. After the complete healing after 45 days, the patients should use first 5 times the condoms for their intercourse, and after that they can consider the sex without condom. However, we advise that you have condom for safe sex. So these are the few questions that always patients ask us and we have to answer. That's why we are making this video. Another question is, when can I drive? So the patients who undergo the ZSR circumcision cannot drive on the same day of the surgery. From next day onwards, they can drive any type of vehicle like two-wheeler or four-wheeler. Next question is shower after ZSR circumcision. So we advise that you take shower after 48 hours or 2 days after the ZSR circumcision for good healing. Next question that we get, how much medicine we have to take? So the answer is, we give at least 5 days of precautionary antibiotic tablets which are mild. Also we give some painkillers which are mild and healing. Also we give some vitamins for 5 to 15 days. So after that you can manage yourself the medicines which have prescribed. Or if you have any questions, you can ask us on WhatsApp. The number is 98238 63926. This is the common questions which we get during these all years. This is a very successful circumcision, and I advise you to consider doing ZSR circumcision because there is no pain, there is no bleeding, and there are no stitches. The most important thing, the scars which occur after normal classic stitch circumcision does not occur in ZSR circumcision because the cut is very sharp. It is not done with scissor, it is done with a titanium blade. That's why the patients get a very scar-free circumcision experience. The pain after the sex will also be not there with the help of ZSR circumcision. Friends, please log on to our website, that is circumcision-clinic.in, where we have all the information, also the photographs, videos, all the materials which you need to finalize your decision for circumcision. And you can always contact us via WhatsApp or email. The description given here in the description show notes, and you can see and contact us directly. We are one-to-one, we are offering one-to-one patient interaction. It is not so that your phone will go to reception. Your phone will directly come to Dr. Sachin Kuber, that is me, and I personally give opinions and help. You can always think of doing an online consultation first with us before coming, so that your decision can be 100% convincing to you and your family members. Only one thing, the patients who are below 18 years of age should be accompanied by the parents while consultation as well as while having the ZSR non-surgical circumcision treatment. So thank you friends for watching this video. I think I was helpful to you, and let me know if you have any questions. Thank you.